are going to speak about the muscle that participate to form the pelvic diaphragm. The abdominal cavity in the superior part in the roof is going to be bounded by the diaphragm muscle. You remember the abdominal cavity?
Yes.
What's another name of the diaphragm? Burning muscle. Now, inferiorly in the pelvic cavity, inferior to the pelvic cavity, you have another diaphragm that we call the pelvic diaphragm. The pelvic diaphragm is such as a boot that you open but not completely, the semi-open of the boot. So the inferior surface of the pelvic cavity, the floor of the pelvic cavity, you can find the pelvic diaphragm. The pelvic diaphragm is bowl-shaped. It is such as a boot that it is not completely open and it is not closed. You are going to open but semi-open. So here in the sagittal section, I am going to remember you the position, the area that you are able to find the pelvic cavity. Some of the muscles are going to participate to form the pelvic diaphragm. Anteriorly, the pelvic diaphragm in each side, right or left side, are the same. The anterior muscle we call levator ani, and the posterior muscle we call coccygeus or coccygeus. So the pelvic diaphragm is such as a boot that you open but not completely, the semi-open, and consists of some muscle. The anterior muscle we call levator ani, the posterior muscle we call coccygeus. Some of the structure are superior to this pelvic diaphragm and some of the structure are inferior. The superior part we call the true pelvic cavity, the small pelvic cavity, and you know the organ inside of the true pelvic cavity or a small pelvic cavity are going to be found superior, upper to this pelvic diaphragm, and inferior to pelvic diaphragm. Here you are going to find the reproductive system. You are going to find the prenatal. So prenatal is inferiorly and superiorly is a small pelvic fossa. In this picture, here is the prenatal and superiorly is the true pelvic cavity or the true pelvic structure. The anterior structure in female sex is urinary bladder and the urethra. The posterior organ is rectum. Rectum, after passing through the pelvic diaphragm, the name changed to anal canal. Between these two, in female sex, you are able to find the uterus and vagina. So the vagina is going to be found superior to pelvic diaphragm and a small portion inferior to pelvic diaphragm. Here, called the prenatal. In the reproductive system, this structure in the prenatal we are going to speak and introduce to you. Now here, it is going to remember you that the pelvic diaphragm is a structure that supports all of the organs in the small pelvic cavity, such as the uterus, such as the rectum, such as the urinary bladder. If in some of the accident or if in any reason this pelvic diaphragm get injury and get weaker, because it is a supporter for keeping, for helping to the pelvic organ to remain in the normal position. If this pelvic diaphragm get weak, it is one of the reasons that it is possible the prolapse of the rectum happen, the prolapse of the uterus happen, the prolapse of the urinary bladder happen. We call cystocele, rectocele, okay? The prolapse of the urinary bladder. Okay. The prolapse of the urinary bladder we call cystocele. The prolapse of the rectum we call rectocele. Look at the picture. It it is the normal position. In normal position, in the female sex, urinary bladder and urethra, uterus and vagina, rectum and anal canal. Now, sometimes it is possible the urinary bladder get weak and come down because cystocele. Prolapse of urinary bladder is possible to happen. During the cystocele, what happened? During the cystocele, when you are going to look at to the vagina, in anterior wall of the vagina, you can find a bulge. When you are going to find the rectocele, then you are going to look at inside of the vagina, the posterior wall of the vagina, you are able to find a bulge. And here, the uterus is possible sometimes coming down. You have prolapse of the uterus. This prolapse of the uterus has so many grades. In the very end stage, it is possible the uterus come inside of the vagina and come outside. We call that here we have the prolapse of the uterus. So one of the supporters for the main pelvic organ is the pelvic diaphragm. If the pelvic diaphragm gets injured, gets weaker, this protection decreases. So, for example, the urinary bladder is coming down, we call cystocele. It is possible the uterus coming out or the rectum coming down and making problem for the people. It is the lithotomy position. I told you that the mother, the female, draw supine and the lower limb abduct from each other. Look at during the delivery that the pelvic diaphragm, it is possible in normal delivery. The head of the uterus, the head is coming at the first. It is possible that this pelvic diaphragm get injured. Now, which structure are going to form for us the pelvic diaphragm? The pelvic diaphragm is going to be formed by some of the muscles. The pelvic diaphragm in female sex from superior view. In this picture, I am able to show you the superior surface of the pelvic diaphragm. In each side, we can split and introduce to you two groups of the muscle, intrinsic and extrinsic. What is intrinsic muscle here and extrinsic muscle?
Side the belt.
The pelvic diaphragm consists of two muscles in each side. These two muscles, the origin and insertion, are going to be found inside of the pelvic cavity. We call intrinsic muscle. And extrinsic muscle, such as the piriformis, such as the obturator internus in each side. These two muscles, only the origin is visible here. These two muscles is going to leave the pelvic cavity through the greater or lesser sciatic foramen, go and attach to the femur. So only the origin of these two muscles is visible inside of the pelvic cavity. We call extrinsic muscle. At the first, I am going to introduce to you the intrinsic muscle. In each side, please notice. Here, I am going to speak and introduce to you the intrinsic muscle, and when I explain for you, it is better, because in your book, it is possible when you read, you confuse. But if you listen and understand here, it is the easiest form that helps you to get in your mind and remember. in each side. Anterior section we call pubococcygeus. So pubococcygeus is visible here. And posterior to pubococcygeus, I am able to show you iliococcygeus. The pubococcygeus and iliococcygeus we can call levator ani. I told you the pelvic diaphragm anteriorly consists of levator ani. Levator ani is visible here. It is a very wide muscle. Consists of two parts in each side. Anterior part we call pubococcygeus, posterior part we call iliococcygeus. So levator ani consists of two parts, pubococcygeus and iliococcygeus. Posterior muscle in pelvic diaphragm is a triangle muscle that we call coccygeus muscle. Another name, another term for coccygeus muscle we can call ischio-coccygeus. Do you know why we can call ischio-coccygeus? Because here is pubococcygeus, iliococcygeus, so we can call ischio-coccygeus. If you tell coccygeus or ischio-coccygeus, both of them is correct. Levator ani consists of two parts, pubococcygeus, iliococcygeus. At the first, I explained the pubococcygeus. Please notice to the pubococcygeus. Pubococcygeus in both sides are far from each other by this space, by this area. What's the name of this area? We can call the urogenital space. We can call urogenital space. The pubococcygeus in female sex, the pubococcygeus in each side, in female sex, the anterior muscle fiber, the medial muscle fiber or anterior muscle fiber, anteriorly attached to posterior surface of the pubis. They are going around the vagina and go posterior to the vagina. Please pay attention. Posterior to the vagina. Posterior to the vagina. Anterior to the anal canal. We have a muscular or fibromuscular structure. We have a fibromuscular node structure that we call preanal body. Preanal body is important. In female sex, you should know preanal body, the structure consists of the fibrous and some of the muscle. You are not able to find any bone here. The skeleton is fibrous and some of the muscle are going to attach to this fibrous skeleton. So we call it is a fibromuscular structure. We call preanal body. Where is the preanal body in the female sex? Posterior to the vagina and anterior to anal canal. Never forget. Posterior to the vagina, anterior to anal canal, we have the fibromuscular structure that we call preanal body. The anterior or medial muscle fiber from the pubococcygeus we call pubovaginalis. Why we call pubovaginalis? Because anteriorly attached to the posterior surface of the pubis, and they are going around the vagina and posteriorly attached to the preanal body. So in your exam, if I ask you, all of the following muscle has or are going to attach to preanal body except what about the pubovaginalis? Yes? Yes. Anteriorly attached to the posterior surface of the pubis, go around the vagina and it is going in both sides attached to renal body. So one of the muscles that it is going to has attachment to the renal body is pubovaginalis. What's the function of pubovaginalis? It is going to work such as a sphincter for the vagina, such as an additional sphincter for the vagina. What's the name of this muscle, pubovaginalis? What's the name of this muscle completely?
Pubococcygeus.
The pubococcygeus in female sex consists of three parts. Pubovaginalis, I go laterally, puborectalis. What about the puborectalis? Lateral to pubovaginalis, some of the muscle fiber attached to posterior surface of body of the pubis, they are going around the rectum, go posterior to the rectum, both sides fuse to each other, and we call the puborectalis. When these two puborectalis in both sides go around the rectum, imagine here is the puborectalis. From the right side, from the left side, go posteriorly and fuse to each other. This fusion is going to lead, making an angle between the rectum and anal canal. Make an angle between the rectum and anal canal. During the defecation, this angle is going to decrease. So the anal and the rectum are straight. But after the defecation, this angle again is going to fall. So the puborectalis from both sides go posteriorly and attach to each other and making an angle between the rectum and anal canal. So the pubococcygeus in female sex consists of pubovaginalis, puborectalis, and the proper pubococcygeus. Proper pubococcygeus is visible here. What about the proper pubococcygeus? The name of this muscle is obturator internus. The name of this muscle is obturator internus. The obturator internus is going to cover by a white sheet. The white sheet is visible here. The name of this white sheet is obturator fascia. So this white color is going to remember you the obturator fascia. This obturator fascia, this obturator fascia in the central part is going to get concentrate, to get thicker, making a small portion, this white color, making the tendinous arc. This tendinous arc is the thicker part or the concentration part of the obturator fascia. Means if you imagine here is the obturator muscle, medial to obturator muscle we have a fascia. What's the name of this fascia?
Obturator fascia.
Now if you imagine here we have the pelvic diaphragm. This pelvic diaphragm is going to attach to obturator fascia. The part, the area that the pelvic diaphragm attached to obturator fascia, this part of the fascia such as here, get thicker. Look at here, get thicker, and we call the tendinous arc. So tendinous arc is the median, the central part of the obturator fascia. It is a site for attachment of the pelvic diaphragm. So some part of the fascia obturator is visible superiorly and some part is visible inferiorly. In this picture you are going to look at to the superior portion of this obturator fascia. Can you imagine? In each side of the pelvic cavity, we have obturator foramen. Which membrane covers the obturator foramen?
Obturator foramen.
Obturator membrane. Inside of the obturator membrane, you have a muscle. What's the name of this muscle? Obturator internus. Medial to obturator internus, you have a fascia. What's the name of this fascia?
Obturator fascia.
You answer to this question. The obturator internus muscle is between the obturator fascia and obturator membrane. Now, obturator fascia, when it is going to cover the obturator muscle, in the central part, in the median part, get thicker and making a tendinous arc. This tendinous arc is a place, an area for attachment of some of the muscle fiber that belong to the levator ani, belong to the pelvic diaphragm. Again, I explained this picture, it is important. From superiorly, you are going to look at the pelvic diaphragm. In the floor of the pelvic diaphragm, I am able to show you intrinsic muscle and extrinsic muscle. At the first, I am going to introduce to you intrinsic muscle. What's the name of intrinsic muscle? Anteriorly we call levator ani, posteriorly we call coccygeus. Anteriorly we call levator ani, posteriorly we call coccygeus. Okay, do you get that? Okay. Oh, excuse me, it is glass. Okay, close the door. Okay, after the glass. Close the door. If you look at the picture, superior to the levator ani and superior to the coccygeus in both sides are visible here. If you look at the levator ani, consists of two portions. Anterior portion we call pubococcygeus, posterior portion we call, what's the name of this portion? Iliococcygeus. Levator ani consists of pubococcygeus, iliococcygeus. And we know the pelvic diaphragm posteriorly consists of this muscle. What's the name of this muscle? Ischiococcygeus. At the first, I explained for you the pubococcygeus, both sides. Both pubococcygeus are far from each other to this space. What's the name of this space? Urogenital space. The anterior or medial muscle fiber of the pubococcygeus we call pubovaginalis. This pubovaginalis anteriorly attached to the posterior surface of the body of the pubis. They are going around the vagina, go posterior to the vagina both sides and attach to perineal body. What's the function of pubovaginalis? They work such as an extra or additional sphincter for the vagina. We go laterally in both sides. Lateral to pubovaginalis we have puborectalis. Anteriorly attached to posterior surface of the body of the pubis, go around the rectum in both sides and posterior to the rectum connect to each other. We call puborectalis. What's the function? Making an angle between the rectum and anal canal. What's the lateral muscle fiber of the pubococcygeus? We call proper pubococcygeus. What is the origin? The proper pubococcygeus is going to attach to anterior portion of tendinous arch. What's the tendinous arch? It is the thicker or concentration of the fascia obturator in the central part, in the median part. So the proper pubococcygeus attached in both sides to the anterior portion of the tendinous arch. Muscle fiber go medially, posteriorly, and attach to each other and making a ligament. This white color is going to remember you the anococcygeal ligament. Anococcygeal ligament in the median part and posterior part of the anal canal. This white ligament is going to remember you that both sides muscles are coming and attaching to each other and making the anococcygeal ligament. The proper pubococcygeus attached to anococcygeal ligament and to the coccyx. Now look at the iliococcygeus. Is it correct if I explain for you that iliococcygeus, the iliococcygeus about the origin attached to posterior part of the tendinous arm? Is this correct?
Yes.
Yes. Also, some of the muscle fiber attached to ischial spine. Some of the muscle fiber attached to ischial spine. The muscle fiber go medially, posteriorly, attached to alococcygeal ligament and to the coccyx. And the posterior muscle in the pelvic diaphragm is triangle muscle. What's the name of this muscle? Coccygeus or ischio-coccygeus. It is triangle, apex attached to ischial spine, and the base attached to the close the door, please. Close the door. It is class. Close the door. And the base is going to attach to the lateral border of the last sacral vertebra and the first coccygeal vertebra. This ischio-coccygeus is attachment is such as one ligament. What's the name of ligament? If anybody answer,
Which ligament?
it is going to increase the final exam.
Can you please repeat your question?
Why?
This muscle is ischio-coccygeus. It is triangle. The apex attached to ischial spine and the base attached to the lateral border of the last coccygeal, last sacral vertebra and the first coccygeal vertebra. It is such as the attachment of one ligament that I explained for you today. What's the name of?
Inguinal ligament?
Huh?
No, no.
Inguinal ligament?
What's the name of triangle ligament?
Alright.
Sacrospinous. Tell me, give me the name. Okay? Okay. This is this answer is going your score at the final exam. Okay? The sacrospinous ligament. Sacrospinous ligament. Do you remember the triangle ligament? This sacrospinous ligament exactly, immediately is behind of this muscle. In some texts, they explain that the sacrospinous ligament is the changing of the sum of the muscle fiber of the coccygeus or ischio-coccygeus to the ligament. So the form, the shape, the attachment is such as it are. Means if I remove the ischio-coccygeus muscle, I am able to show you the sacrospinous ligament. If I remove the sacrospinous ligament, I will be able to show you which ligament? Sacrotuberous ligament. Okay? Now, look at to this space. This space helps to you very easily be able find that this part is pubococcygeus, this part is iliococcygeus, and this is the coccygeus. These two muscles are going to form the pelvic diaphragm, and the pelvic diaphragm needs to be innervated. The pelvic diaphragm is going to be innervated by the fourth sacral nerve, For the next time, please read about the innervation of this muscle completely for tomorrow. Read the innervation of this muscle by yourself and bring the answer. Which nerve are responsible to innervate the pelvic diaphragm? Okay? And what's the function of pelvic diaphragm? I've told you it is a supporter for the organ. Yes?
Yes.
And today I explained for you it is going to make an angle between the rectum and anal canal. Okay? Bring all of the function of this muscle to the pelvic diaphragm tomorrow for me. So, in your exam, it is possible, I ask you, which of the following muscles are going to attach to tendinous arch? Ischio-coccygeus?
No.
Iliococcygeus?
Yes.
Pubococcygeus?
Yeah.
No.
Yes?
Yes.
Yes. The proper pubococcygeus attached to this tendinous arch. arch. So pubococcygeus also attached to the tendinous arch. Now I change the picture. In this picture, from superior view, you are going to look at to the pelvic diaphragm in the male sex. Pubococcygeus, iliococcygeus, both of them we call levator only. And here is the ischiococcygiosis. All of the structure that I explained for you in the female, you can see is visible in the male sex, except pubovaginalis in the female sex. In the male sex, you are not able to find the vagina. Instead of pubovaginalis, that it is the anterior or medial muscle fiber, in the male sex, we have levator prostate. Levator prostate. So in the male sex, anterior muscle fiber or the medial muscle fiber anteriorly attached to posterior surface of the pubis, they are going around the prostate, and posterior to the bone of the penis, it is going in both sides attached to the renal body. Now you are in exam. It is possible, I ask you, all of the following muscles are going to attach to the renal body except levator prostate, right side, yes. Left side, yes. Pubovaginalis, yes. Right and left side. Puborectalis,
No.
no. Puborectalis never attached to renal body. So you should know the name of the muscle that attached to renal body. Now look at to this space. In both sex, we call urogenital area, urogenital space. In the male sex, ligaments that are going to fill and are going to occupy this space in the male sex we call puboprostatic, and in the female sex we call pubovesical. So homolog to the pubovesical that found in the female sex, homolog to pubovesical in male sex we call puboprostatic. This was some of the questions in the last semester. Homolog of the pubovesical in the male sex we call puboprostatic. Now look at to these two muscles. These two muscles we call the obturator internus and piriformis. The obturator internus and piriformis, you read about these two extrinsic muscles in their lower leg. Look at to the piriformis. Origin attached to anterior surface of the sacrum. The muscle fiber converge, go to the greater sciatic foramen, leave the pelvic cavity, go to the gluteal surface and attach to the superior part of the femur. Obturator internus attached to medial surface of obturator membrane and the bone around the obturator foramen. The muscle fiber converge and making a tendon. These two tendons leave piriformis and obturator internus, leave the pelvic cavity. Only you should know the piriformis leave through the greater sciatic foramen and the obturator internus leave through the lesser sciatic foramen. Okay, we get that? This is important. The obturator internus leave the pelvic cavity through which foramen? Lesser sciatic foramen. The piriformis through the greater sciatic foramen. What's the name of this fascia? Obturator. What's the name of this white line? Tendinous arch. This is a sagittal section belonging to the female sex. Urinary bladder, urethra, uterus, vagina, rectum, anal canal. So it is a section from the pelvic diaphragm. Again here, two extrinsic muscles of the pelvic cavity is visible, piriformis and obturator internus. What's the name of this ligament? Sacrotuberous. What's the name of this ligament?
Sacro.
Sacrospinous. And here, again, you are going to look at to the piriformis leaving the pelvic cavity through the greater sciatic foramen. It is a good picture. Look at here. We remove the sacrotuberous ligament, remove the sacrospinous ligament to be able to show you the sacrospinous muscle. Okay? Sacrococcygous muscle. It is sacrospinous ligament, do you remember the pubococcygous, iliococcygous, ischiococcygous? It is the ischiococcygous. I told you, behind of the ischiococcygous, some of the muscle fiber change to ligament and making this ligament. What's the name of this ligament? That's your classmate. Sacrospinous. Behind and superficial to sacrospinous, you are able to find sacrotuberous. It is the lithotomy position. You are going to look at the pelvic diaphragm here, inferior. So here is the urogenital space. Here is the position of the penile body, sacrotuberous ligament, ischial tuberosity, coccyx, and piriformis are visible. And about this picture, after this is okay. 11:30. Come back to the class. I'm going to finish the box.
I'm gone.